Topic of discussion today is pelvic organ prolapse. My name is Dr. Haley Van Beek, and we are going to discuss what pelvic organ prolapse is, who may be at more risk for developing a prolapse, what are the common signs and symptoms, and then how can we care for and manage our prolapse. Let's get started. So first off, what is pelvic organ prolapse? Prolapse is essentially the descent of one or more of the pelvic organs into the wall of the vagina. So this could be either or you've got your rectum, your uterus, and the bladder here. And you might be able to get a little bit of a better view of how they connect to each other around that vaginal canal here in this view. So there's that rectum back there, vaginal canal, and then that bladder. And so essentially they are descending. There's some laxity of the tissue, the connective tissue that helps hold these organs together and to the bones within the pelvis. There could also be some weakening of those pelvic floor muscles as well. And so we just get this kind of heaviness, bulging type of feeling. So then who is at more of an increased risk for developing pelvic organ prolapse? Typically women who have had babies, so specifically if they had a prolonged labor that was greater than 2 hours of pushing or less than 30 minutes of pushing, so baby came too slow or too quickly. Also, if they sustained any perineal tearing, lacerations, or avulsions of the pelvic floor muscles and nerves. Additionally, if they had a delivery via assistance of a vacuum or forceps, that would put them at an increased risk for developing prolapse. Additionally, there could be increased risk for prolapse with those who have a systemic or connective tissue disorder where they already have weakening and laxity of their ligamentous tissue and connective tissues. And then also those who lift repeatedly and heavily as either their work, occupation, or they enjoy doing that weightlifting as a form of exercise, as well as those who may be doing any type of physical activity where they are breath holding or straining. And kind of to follow along with this one is chronic constipation. So this is another form of chronic strain where there is increased pressure being placed down on the pelvic floor. So then what are some common signs and symptoms of pelvic organ prolapse? Oftentimes there is this feeling of pressure down in the pelvic floor. People will say it feels like something is falling out, or there is this vaginal bulge sensation, which, speaking of a vaginal bulge, sometimes women can actually experience this where they have some of that internal vaginal tissue that is bulging right here at that opening there. So this isn't a good thing because a lot of times there can be, obviously discomfort with that. There can be bleeding, there can be irritation, even infection sometimes, as that tissue is not meant to be exposed to air or rub against, underwear. So there can be some discomfort with that as well if the prolapse is to that stage. It's not always to that stage. Additionally, other signs and symptoms might be that you feel great in the morning, but by afternoon, evening, and or if you went out for a walk or did some physical activity, you might feel like your symptoms are worse, and that's because the impact of gravity and or straining, depending on what that activity might look like for you. It might also be challenging to or more difficult to have bowel movements or urination. So a lot of times people will find that if they digitate or they use their finger to help support their vagina during urination or bowel movement, that they're able to get things out better. So that's kind of a technique that you can end up using as well as a common symptom that you might find. Also, people might, say that they have this low backache, and not so much pelvic pain isn't as common, but a low backache is more common. And this is because those ligaments that attach all of the organs together and then to the bones of the pelvis are attaching back to your tailbone, your sacrum, your low back. So if there is weakness and laxity, stretch on those ligaments, they're pulling on those bones, and that can create this sense of this low backache. So then how do we best manage pelvic organ prolapse? The biggest issue with prolapse is essentially this pressure management issue. So we really want to make sure that we can optimize the pressure management and exchange within the body. This means to eliminate straining, so whether that's straining with bowel movements or heavy lifting, and we want to decrease breath holding as well with these activities. So the best thing that you can remember is to exhale on exertion. Additionally, with preventing chronic straining with constipation and bowel movements is to try to put your body in the best optimal position to evacuate. So what this could be is, finding a trash can, turning it sideways, maybe using a squatty potty, and getting those knees above your hips so you're in more of a squat position on the toilet. This just puts the rectum in an optimal position to eliminate. You also could use the tip that I discussed earlier in, supporting the vagina either anteriorly or posteriorly as you go, because that just gives you more support. Speaking of support, either during the day or physical activity, sometimes additional support is necessary, whether that is internally or externally. So internally, you may try using a tampon or something called Impressa, which is specifically made for prolapse and bladder leakage. Then there's something that could be more long-term internal support, that is a pessary, which really ultimately needs to be fit by a physician for you. But there's also external supports you can try, whether that is kind of like a strap or a undergarment type of thing that just gives you more support in the perineal region. And then also we need to talk about strengthening, so pelvic floor strengthening specifically. Obviously, we want to work on your core and hips and everything else as well, but the pelvic floor is oftentimes a weakness issue with prolapse. Not always, but we definitely would want to make sure we address that if that is part of the problem. And then last but not least, see a pelvic floor physical therapist. So what a pelvic floor physical therapist can do for you is really, hone in on what the issues specifically are for you, and then tailor a home exercise program and a treatment plan that's really going to target your needs and help you get to where you want to be and reach your goals. So go see a pelvic floor physical therapist like me. I would love to help you through this.